Hi, I'm Kathy. Today I want to share with you another piece of research based on some of the conference that I attended to in August for the American Psychological Association. I was excited to get to hear Dr. Catherine Lord from the University of Michigan speak again. I've heard her several times before in previous years. I still considered her to be probably the leading researcher in autism spectrum disorder here in the United States. And that, of course, is what she spoke on again. There is a lot of confusion as this spectrum sort of widens in its diagnostic criteria. Most people can agree that the core domains for autism spectrum disorder are going to be some type of social impairment, speech impairment, communication deficits, and either repetitive behaviors or very narrow and restricted focuses of interest. And also some type of language disorder tends to be one of the core issues here. But the real question becomes, as we widen this spectrum, how do you differentiate between autism, Asperger's, and PDD-NOS? That has always been a question mark, and I get a lot of emails from people, a lot of questions. A lot of times there's confusion on the part of parents over how to separate these. There's confusion on the part of clinicians. One of the things that Dr. Lord mentioned, which is interesting and also concerning at the same time, is that when they looked at how clinicians separate autism, Asperger's, and PDD-NOS, what they found is that the clinics around the country are in clear contrast with each other. In other words, clinicians do not agree on how to separate those. And sometimes the only criteria for how a child is diagnosed, as whether they're diagnosed as having autism, Asperger's, or PDD, is simply the clinic that diagnosed them. So until we get some sort of uniformity in the way that people do separate these three, most clinicians do agree there is difference between the three, but exactly where you draw the lines and how you draw the lines, there is a lot of confusion on that. And so that makes it really hard for us to continue to do seriously reliable research in one of those domains until we have clear criteria on it. The other thing that she brought up was looking for simple ways to diagnose autism in young children, because anyone who's involved with autism knows one of our big frustrations is that even though we can diagnose autism in as young as an 18-month-old, still to this day the vast majority of children are not getting a diagnosis for autism until around the age of 5 or 6. And so that's a lot of time lost without being diagnosed. So she was giving clinicians and parents and educators some things that they can look for in young children that they may suspect have autism, not Asperger's, but true autism in the autism spectrum disorder. Eye contact. Watch for, does the child make eye contact with the adults in the room? And here's a critical piece. Does the child communicate by gesturing towards things by using other people's body parts? Rather than pointing themselves to a dog, do they actually take the hand of the person and lead them over to the stuffed dog, or to point using other people's bodies? The other thing that you can look for is ignore the child and see what happens. In a young toddler who does not have autism, a toddler will wait on average 7 to 11 seconds. That's it, 7 to 11 seconds, and then they will go and initiate and try to get attention. Whereas a young toddler with autism will wait hugely long periods of time without seeking out attention. So those are a couple of real easy pieces that you can look for if you are trying to get some kind of support to look a little further in a young toddler. For more information on this topic or to see the citations, you can go to brains.org.